This is about this gut health. I'm supposed to talk about the gut health, the signs and symptoms that reflect that you have a bad gut health and the disease caused by it. Actually, the symptom is also reflecting that you're getting the disease. Yeah. So I splitting into 4 parts. Cause. First one is direct cause. Obviously, probiotic is colonized in your digestion, in your small intestine and large intestines. Poor gut health, reflecting that you have symptoms of such as reflecting that you have the disease like GERD, which is a gastric reflux disorders. The gastric esophageal reflux disorders mean you have the acid that which reflecting back. So you will have the symptom of heartburn. You're right here like burning sensation over here, burn, and then the bitter mouth, then a lot of burping, and then also can cause gastritis symptoms, of which you have pain and discomfort over this called epigastric regions. So if you have this kind of gastric symptom, pain over here, indigestions, then burping, that's a reflecting that you have a bad gut health. That you actually have gastric. Then you might want to do scope, the gastroscopy, which you see that there's inflammations over the stomach. The inflammation of the stomach that are directly cause that you have a bad gut health. We don't think that it's something simple because it will increase the risk for you getting a cancer, gastric cancer. Another thing is you have frequent diarrhea, drink some meal, spicy food, a little bit more spicy food, mala tang. You already order mild types of spiciness, but I then also got diarrhea. Then eat oily food, also got diarrhea, very sensitive. Then that also may mean that you have irritable bowel syndrome. Mean that your stomach is very sensitive. A little bit that you got diarrhea, a little bit that you got constipation. One moment constipate, one moment diarrhea. Then you're causing a stomach pain, bloating type of pain. Then if you do some tests, sometimes you do some tests that way you can buy, you can blow and then test whether you got H. pylori positive. There's also a sign and symptom that you have a poor gut health, that which the bad bacteria, one of the well-known bad bacteria with increased risk of the stomach cancer is the Helicobacter pylori. Helicobacter pylori, if you're positive, you better get treated. So what you go to see doctors, then what they will treat for you? Antibiotic after antibiotic. So then antibiotic will kill the probiotic, the good bacteria. So actually it doesn't really resolve the whole issue, then actually will make it worse. And then later your bad bacteria like such as H. pylori can also regenerate, then the good bacteria regenerate slower than the bad bacteria. Then again the Helicobacter pylori will again recolonize, and you again next year you test also still positive. Like cycle. So every year can prescribe you antibiotic money. The probiotic actually is very important. Probiotic is all the direct signs and symptoms, direct signs that mean that you have a poor gut health. Have a poor gut health, then you need to do something. If you don't do something, then why are you feel afraid of cancer? When you get cancer, whole year you are admitted to hospital 6 times or more than 6 times doing chemo. Very bad, very sad. Not only just diarrhea. You think that, just a couple of diarrhea, just a couple of diarrhea, indigestion. No, it doesn't matter. It's a sign that if you don't take care, it may lead to more serious illnesses. Indirect caused by the poor gut health. First, we have to understand 70% of your immune systems relies on your gut. So one of the indirect signs and symptoms is about your poor immune system. The poor immune system also means that you have a poor gut health. Step 1 to improve your immunity is to improve your gut health because 70% of your immune system is in your gut health. It's logic why 70% of your immune system is in your gut health, because most of the toxic enter from the gut. So one of the same sign and symptom of a poor gut health is hypersensitivity, which is allergic like asthma, Rosdung, allergic rhinitis, eczema, skin allergic, makan ini allergic, a bit dust also allergic. Then give you what medicine? Antihistamine. Antihistamine is to anti-allergic, and also give you steroid. Steroid. Your asthma, rhinitis, or eczema, we give you steroid. Suppress your immune system. You have problem with immune system, and again suppress your immune system. Then it will make your immune system become weaker lah. But very fast lah. If you take steroid, very fast, instantly. Your rashes or your swelling will resolve. I mean, of course, sometimes we really need that. We really need that. Your whole face swollen. So of course, you need to be fast to resolve. But we really need to treat the causes. Is weak because of the poor gut health. We must improve your gut health. The first thing is to improve your gut health is to take the good probiotic. Having frequent cough and cold. You cough and cold for 2 weeks, pun tak hilang, then cannot disappear. Means reflecting that you have a weak immune system. Then you go to see a doctor, to give you antibiotic. Still not recover. Give you a second antibiotic. Still not recover. Oh, maybe you got TB. Do X-ray, everything. No TB. So all these things, you ask yourself. Then skin infection. Then you can see people got very bad skin health one. Spotty. Ada bisu sini, bisu sana. Boy here, boy there. They have this very bad kind of immune system. You get easy. Then of course you go and see doctor. They will start use on antibiotic again. Okay. So of course it's no choice. Painful, kan? Bisu is painful. Then you really need to do something. So but you need to prevent. We need to prevent. Or you recently have a severe infection, lung infection, admitted to the hospital. Or you're having fungus infection. Autoimmune diseases such as rheumatoid arthritis, SLE, psoriasis. All these autoimmune disease are reflecting that actually poor immune system. Most commonly we use steroid again. That go in the cycle lah. I mean you can't really get well. Then once the steroid remove, then you become worse. Rebound. Then it become worse. Symptoms, third sign, indirect sign, symptom is inflammations. Your body are very inflammatory. Now, very inflammatory. A lot of free radical, a lot of toxic in your body. Very heavy. Headache, body pain, hair pain, back pain, leg pain. Not because of exercise. Exercise kind of pain is different. In the office, you hardly you need to do any exercise. But after that, you feel pain here, pain there, all this pain. Sleep, you sleep, wake up, neck pain. Why? You sleep also get pain. So this is because your body is inflammatory. Overweight. Drink water. Also overweight. Drink water also increase weight. Why like that? Because of poor low metabolism. Why low metabolism? Because of all these free radicals, very heavy. Your body very heavy, loaded with all these free radicals. Then low metabolism will lead to metabolic syndrome. Metabolic syndrome such as hypertension, diabetes, high cholesterol. This is metabolic syndrome. Gout, osteoarthritis is all inflammatory disease, which is also again reflecting. Of course, partly is poor gut health can be related with genetic kan. But I'm talking about in general. If you have these symptoms, mean that your body is high inflammation. High inflammation, and another mean that you have poor gut health. Not least is we talk about the brain, nervous system. Why I talk about this? Why gut health is related with nervous system? Because 100 million nerve cells relies on your gut. Rely on your gut. So poor gut health will reflect on will cause poor nervous system illness. People who have anxiety, high level of anxiety, tends to have poor gut health. People who have poor gut health tends to have high anxiety symptoms. Anxiety, depressions, very stressed, difficult to sleep, insomnia, forgetful, or maybe you meant dementia. It's all related. To treat depressions, we increase the level of serotonin. So 70% of serotonin is made from your gut. Comfort food, the comfort food. You eat your flavored food can make you happy. Because a good food can increase good bacterial probiotic as well as increase serotonin levels. Which should make you happy. So it's true that eating healthy and tasty. Yeah. Then other nervous system is like often people mention a lot. Yeah. Especially people with anxiety. If you the hand numbness, numb here, leg also numb. It could be diabetes lah. Could be diabetes or whatsoever. What other reason, or you have atherosclerosis. But the numbness could be because of some nerve damage, hand tremors, migraine, stroke. You have stroke, yeah, and all these other illness in nervous system, like Parkinson disease, all these things. Yeah, it's all the nervous disease. Then the symptoms, signs and symptoms, just I mentioned, the hand tremors, so easily stressed, sweating, yeah, all related with poor gut health. And then the first thing you should improve is your gut. So first thing is your diet practice lah. Number one, very bad diet practice. You don't eat breakfast. Empty stomach. 7 to 9. You don't. Oh, I take breakfast. I take at 11 o'clock. That is not breakfast. It's brunch. Yeah. 7 to 9. Have your breakfast. Yeah. At least you have some drinks. No. I mean, a lot of people say, I drink a coffee. You know, coffee. Although they have a milk here. Number one. Two things is not good for health. Number one is milk, because Asian people cannot really digest food. It just seems like how bad is your lactose intolerance, because the milk inside the coffee is not a lot, so you won't have diarrhea, but it's not good for your gut as well. So taking milk or milk byproduct frequently or every day is not good for your gut health again. And don't eat breakfast. It's not good for your gut health. Your breakfast might consist of, the good breakfast might consist of suku-suku sepalo lah, protein, fibers, and some carbs. Yeah. Even if you want to skip some carbs, because almost all the food will have some carbs lah. I mean low carbs lah. It's fine. Not drink coffee together with other food. Yeah. Or you eat too late, after 9. They call it dinner. Supper actually. It means that eat too late means you don't eat supper. You don't eat supper. Or eat too much. Especially too late and too much. Or you eat processed food. Yeah, processed is a rubbish food which your body cannot even absorb and metabolize. So it will stuck in your body for periods of time. It's not like the other food that can just metabolize within a day, you know. Another one is highly sugary, sweet food. Yeah, it's also not good. I mean, moderate amount of sweetness. If you are not diabetes, is fine. Choose a good sugars. Yeah, but too sweet is definitely very harmful, and especially the processed type of sugars. Yeah, processed type of sugars. The syrup, corn syrup, is extremely bad. Yeah. And the spicy food, I mean, I don't say don't eat spicy food now. In Malaysia, it's way too spicy. You don't eat too spicy food. It's also harsh for your stomach, actually, your digestions. Fry and oily food, and also another one, fry, deep fry, you know. Especially if you eat very frequent, yeah, that is very bad. Yeah, for health, it's good for your gut health. Is probiotic, yeah. We need additionals, yeah. Hardly lah, we can have food that contain a lot of bacteria go into your body. After you makan the food, which got 5% of bacteria goes to your stomach. 99.99%, that's just like your East Spring. 99.99% destroyed by your gastric juice. You have 0.005% left in your gut. Then you may not have good bacteria as well. But the bad bacteria will eat sugar. The good bacteria will eat fiber. So invariably, if you eat a lot of high fiber food, your bacteria, probiotic, your good bacteria will grow. Yeah, will grow. But I know, you look at nasi lemak lah. Where is the fibers? we don't have enough fiber, so we must have fibers. One of the things is we would like to talk about the Nutrilite probiotics, which is the Nutrilite probiotic is the only one so far in the market. First thing is they have a 6.3 billion CFU. CFU means colony forming units. Mean one unit of this bacteria can form one whole colony. Yeah, and then 5 strains. Yeah, and also the third one is chicory root. Yeah, chicory root is a Chinese herbs. Yeah, which contain inulin, which is a prebiotic. Fiber is also is insoluble fibers. Inulin, which are food for bacteria. So the good bacteria needs food to form a colony. Yeah, form a colony. And the most important thing is this 6.3 billion 5 strains of good bacteria are alive. Yeah, they will arrive in your gut, your intestine. 90% of them alive, because everyone know that all the living beings have a species name, species. So now scientists, this is exclusive, scientists have discovered all the bacteria have strains. Like we five species of the 5 strains of the probiotic that colonize in different places. Like for example, Bifidobacterium lactis, HN019, the special strains that are very good. We detected is extremely good, the best, yeah, and then able to pass through gastric juice and alive into your gut, alive. And another one is Lactobacillus acetovirus, NCFM. Yeah, the strain is all in number. Not like us, we have name, right? Or the third one, Bifidobacterium lactis B1-04, Lactobacillus paracels LPC-37, Lactobacillus acetovirus LA-14. These 5 strains exclusive. I mean that outside the probiotic you don't able to find that, which they selected the best out of the best and put into the probiotic for you. Then so that's why this the best of the best probiotic. So I mean, if you have all the symptoms or you don't have all the symptoms, even though you should take this for preventions of health, preventions of illness. If you have all these symptoms, you need to prevent it to get worse, and you may recover from the illness. Like for example, gastric. I have several of them. They have gastric, gut symptoms. When you take probiotic, like I think 2 weeks, the symptoms disappear. No need to take antibiotic again.